Okay. We have a number of questions sent to us by the students. The first one is, as USMLE step 1 is going to pass fail, how is it going to affect the CV? And what timeline changes you recommend for the beginners who have just started the prep?
First of all, thank you, Usman and Minail, for having me. It's a true honor and a privilege. Regarding the USMLE, we just published a study and should be coming out soon. But basically, there's going to be a paradigm shift in how the program directors are going to evaluate CVs. Now, the overall uh, components of a CV are becoming more important. So, what are your extracurricular activities? What have you published? Your personal lifestyle, your achievements. So it becomes an overall picture of, what do you bring to the table rather than just scores. So that you have to understand is that new change. The personal statements are going to become more important. The letter recommendations are going to get more important. And then step to CK would be the new step one score now. So for someone who has not started, I would strongly recommend that try to study hard for USMLE Step 1 as soon as they can. Now there's no pressure in terms of I really need to get a 99 or 250, 260, so sooner the better. Because the other thing we need to do is once you're done, you need to find electives and observerships because those are going to become more important now than before.
Okay. The next question is, research articles or electives, what has more weightage on CV?
Clinical electives are the best way to go about it because you get hands-on clinical experience. Many programs want a hand-on clinical experience. The next best step would be observership. Definitely, observership would be better than not doing anything. But if you have a choice, elective is highly rated compared to an observership.
Note, Dr. Sandeep want you to choose between research articles or elective.
Research
Articles or research articles or electives.
Okay.
Which one has more weightage?
So it's not a fair question because you have to understand why people are doing what. So if you are a medical student and you have the chance to do an elective, you should definitely do an elective. Now, if you have the chance to publish, you should definitely publish too. So unless you are saying that you have this both opportunities at the exact same time, which rarely happens, then okay, I get your point. But usually as a medical student, you should go for electives. And if you are choosing, for example, want to go into ortho or ENT, ophthalmology or radiology or general surgery, then sure, research would be very key because you need a strong context. So if that's what you're going after, the overall picture, for matching into a competent residency, the research experience carries more weightage or would help you more than a 2 or 3 months of elective, because in 1 or 2 months you won't know the person, they won't be able to help you much. They would be able to write you a letter, but when it comes to competitive fields, then you may want more than just a letter. You want more commitment from your mentors and help. So in that regard, research would be the thing to go to.
Okay.
So I would like to add that in the current case scenario, many people think that it is impossible to get a surgical residency into the US, and it is nearly impossible as stated by many of the people. So many Cancolians here think that it is impossible, and they'll just give up their surgical interest due to the fact that it is difficult to match in the surgical residencies there. So please, can you update us about what is the number of Cancolians matching into surgical residency these days? I mean, what are the current situation or the number of people matching into surgical residencies as per now?
That's an excellent question, Minahil. I totally agree with that it's very hard. I totally agree that it can be considered near impossible, but I think it's much easier than near impossible. It is very hard, don't get me wrong, but I think we need to understand what we're dealing with. I think that's the important part on how we can get there. When you ask me about the medical students, I know right now 7 medical students who I have known through research and through other venues. They are currently doing surgical residency in the US. Now it has been very hard for them, but now many of them are categorical general surgery residents. And yes, they had 250 scores. They had good mentors. They were lucky enough that they were able to I was able to help them in that regard, that they were able to do some research, and then they met a great mentor at University of Arizona and other places that they could get all the help they needed. But I think it cannot be stressed enough that it was their willpower to get to where they wanted to be. So I think the people try to make a comparison with medicine. Of course, it is easier, but I don't think in this day and age it is much easier than medicine, because I feel overall all the surgical residencies are going to get are getting harder for IMGs anyways. But this USMLE pass fail may help people get into surgery. It may hurt them, it may help them. It may help people who were really, really enthusiastic but got very depressed because they were not going to score well in USMLEs. So it does help them. Whereas if they were 250, 260 scorers, then I guess for them the world does change a little bit, that now they have to do more research maybe. So things are going to change for them, but I think overall it may be a little change for everyone, maybe good for some, maybe bad for the other. But if you ask me for my example, I did not score well in USMLEs, had a hard time with CS myself. But I got the foot in the door, and then people want to help you. You just have to be committed to the field. I think it's very important. But I do understand, and I cannot strongly force people or recommend strongly that you have to go into surgery. I think it's a decision you need to make for yourself. But I talk to the medical students, and basically I can tell by talking to them that they really want to be a surgeon. And once I feel like they really want to be a surgeon, I see how I can help them. I get phone calls, for example, I'm getting categorical interviews from 4 places and 2 prelims from general surgery. What should I do? I'll be honest with them. I would say that, you should go into medicine because first of all, no one can support going into prelim surgery over categorical spots. That's number one. Number two, if you are someone who really wants to do surgery, I don't think you should be applying for medicine residence, period. So because then it saves you this headache of this phone call, which may be a good headache to have. I'm getting a prelim versus a categorical, but I don't think I will be surprised if that person ever chooses a prelim surgery over a categorical medicine, because I think it's basically a bad decision that you're going to go into prelim surgery. If you were that committed, you should just go into a prelim surgery and not think about medicine. I understand, things change, and that's a decision that you have to make for yourself. But it's very doable. I know people who are doing it. I know from King Edward, I know from all over the world. I know from Aga Khan, I know from other medical schools that they would be the first people to go into surgery, and it's all doable. And I try to chip in, but I tell you, it's all their commitment.
Yeah, thank you, sir. So you just mentioned about your scores and all that stuff. So a lot of people are here from 3rd year or 2nd year. So I would love if you could just briefly tell us about your journey from being a Chemicolian towards being a transplant surgeon in the US. How did it all went? And just tell us briefly about your journey, sir.
In terms of training, I always, wanted to be the best as we could all do. I think that's what we all want to achieve. And I really wanted to go to England because all the surgeons that I admired were British trained. But, at that time, there was Khaja Muhammad Azim, who was a professor, and he guided me that, if you want to be a surgeon, you have to go to the US. So I really wanted to be a surgeon. I still remember missing OBGYN classes, never delivered a baby. Because I was always in surgery department, just trying to learn and get better. So, it was the enthusiasm. Then what I did was at the 5th year, I got electives. I did five surgical electives. One of which I paid about $1,500. I don't recommend it now, but if you only have one, sure, you should do an elective, because in elective, I really learned the system. I struggled a lot as a medical student, but what I did was I made a lot of bonds, and the person who was a chief resident in one of my electives became a program director at the other hospital. So you can see how context can help you. So that was my experience with electives. And then when I was leaving many places, I told them I want to come back for research and so forth. So that builds up the first part of the process. Then what I did was I did my CS before I leave. So, I thought, I didn't pass CS. There are many reasons why I didn't pass, but I thought my preparation was good, but it was a shocker. It was a shocker. It was the first time I had ever failed an exam. I could, it was just unbearable. And at that time, I've not done step 1. I've not done step 2. So it was a very hard decision. So then, anyways, I said, I'm going to keep trying. So I did talk to a couple of people. You will soon realize the less you talk to people, the better also, because, nobody can gauge what's going inside your head. You can tell them the story you want, but you may not be telling them the entire story. So I talked to some people. I got it that it's going to be very hard, and I would have to do research, so which I always wanted to do. So I did step 1. I got 219, and then I did step 3. There was 239, and then so step 2 was better than step 1. And then I started doing research in North Shore, LIG. I spent about 6 months there. I published 2 papers. They would not sponsor a visa. So I then went to University of Arizona. I remember you just email everyone. I saw an interview on CNN from the trauma chair, Dr. Peter Reed. And I was very impressed in how he saved a trauma patient. And, I just emailed him, and I knew I would not get in there, but I was wrong. They emailed me back, and they were happy to have me as a research fellow. I spent a year with them, and I was mentored by Dr. Joseph there, and Dr. Fonson was my program director. They all played a very crucial role in me being successful. And then, you apply for fellowship. I went to USC. It was a great program, and now I am at TUS. And each and every way, I can tell you that it became very easy for me to just say, I'm going to quit. When you're growing, and when I was in your shoes, the only thing was somehow I need to match. But then you realize, even after matching, the uphill battle continues. The battle to be the best, the battle to be a surgeon, the battle to be a physician. So it's an uphill battle regardless of what you go into, and you enjoy the journey as much as you can, and that's the spirit to go with. But I'm telling you, the overall, this residency is only one piece of the puzzle. You have to live your life after that. So you can't choose a specialty because it's just hard. It may be harder, but it may be more fruitful. You may enjoy it more. Otherwise, you'll be burnt out. You want to enjoy what you're doing. So I guess the message that I want to give from what I learned is, you cannot give up. It's just not possible. If you want to give up, you're not going to make it. And it's not even just for residency. It's when you become an attending, you see patients who are very complex, needing complex operations. It's very easy for me at times to bail out and be like, no, you're very complex, but you take on a challenge to help patients, and that's what it is. You will be challenged for fellowship, for residency, for internship, for everything. But one thing that you should do differently than what I did was try to do well in CS, which is, thank God, no longer a part of the puzzle. But if you can somehow do better than what I did in CS, I think life would be easier, because it's already much harder to begin with, and you don't want that hardship with you to linger on. So my only recommendation would be to just you still would have to do research and whatnot, but I think overall your life would be a little bit easier than what mine was because of not doing well in some of the exams.
Okay.
Yes, sir.
Sir, the next question is, when is a perfect time for undergrads to start applying for the electives?
I think the perfect time would be the middle of 4th year, because I think by the end of the 4th year, they still would figure it out, how to send out an email, who to email, who to find. And if you find someone who's like, yeah, we're willing to take you, then you should be honest with them that you want to come on at the end of the 5th year, after the professional exam. Or if they're not willing, then you try to make up a plan to visit sooner. But you want to do it at the end. First, you will be more smarter because you've done all the medicine education. Second, you want that memory to be fresh in their minds that you will be applying for the match. So the best would be to go to an elective later rather than earlier.
Okay. Dr. Sil, you have seen the working conditions in Pakistan and now you are working in US. Uh, Can you compare the lifestyle and the working condition in hospitals?
I can't compare the lifestyle because, I'll be honest with you, I was with my parents for 2 months and I had the best lifestyle. So I can't argue about the lifestyle. I think, lifestyle is based on your whatever your goals are. But I really had the best time in Pakistan when I was there. In terms of the working conditions, I would say, unfortunately, it's a day and night difference. I'll tell you about the US. The US system is more a preceptorship, a mentorship program. You come as an intern, you're watched closely, you're told what to do, and your responsibilities are defined, your duty hours, you have expectations, you have to log in 100 cases. And then as second year, third year, you get ICU rotations and rural rotations, and then you get autonomy, more control autonomy and more autonomy as you become senior. And during fellowship, it's like you're a junior attending. So how I see it is it's more like a tailored developmental program. What I feel in Pakistan is for surgeons, you have to be talented. Some of it is natural abilities to be offered, but many are not there and nobody is a born surgeon. I think they all need mentorship. And I think the major difference is the mentorship, that where in the US you are mentored, your hands are being held by trained doctors and they want you to succeed. And the other thing I think is the difference is they want you to succeed rather than wanting you to fail, because you're their graduate. They are honored. Like I did my first transplant and my program was, they felt so happy for me that, that I'm a transplant surgeon and so forth. So that's the other thing, that they want you to be successful. So that's the other difference that I felt. But I think the structure is the main key.
Okay. What are the additional things going to boost the CV apart from step 1, step 2?
Yeah. So I think the COVID-19 has opened our eyes that how telemedicine is a big deal, and doing tele research is a great opportunity. I've been able to work with a medical student before. I've been working with Usman, with Shahzeb. I've been working with a student in Aga Khan. So, online also you can find someone who can mentor you and help you with the research project. I think if you can get a publication or 2 in an American journal, I think that will be a huge plus in your CV, something that not many can reproduce. So I would try to see if you can find someone who you can do research with while being in Pakistan. I think that would be the best thing. Staying in Pakistan, I think, don't underestimate the value of volunteer works. I still remember I volunteered in earthquake in 2008, and I put it on my CV, and they really asked me questions about it and they were impressed. Which brings me to another point, that make sure you read your CV before you go for an interview, because you never know what they're going to ask. So yeah, the volunteer work would be one, and then research. If you can't find someone from the US, second best would be to find someone in Pakistan and get some article published, because something is better than nothing. So if I was you, I would be focused on, somehow passing step 1. I would be focusing on electives. I'll be focusing on, trying to build contacts. I've told medical students, I told them at King Edward also that, they have to come up with a professional Twitter account with a nice picture, with with where they're associated with whatever their goals, and then start following the leaders in the field, and you will be surprised. You get contacts from them, and maybe they will be willing to help you out in doing some research. I cannot underestimate the significance of social media.
Now we have another important question. Is an LOR from Pakistani doctor is effective on CV?
You see, the answer is no. The answer is no because they really want. So why is the answer no? The answer is no because they don't trust our system. They are hesitant in thinking that our system is reliable. On the other hand, in America, everybody has a system. They are all basically doing one way or the other, the same things. So they trust the system. So that's the main issue. But I mean, if you don't have anyone, sure, you should definitely get a letter of recommendation from one of your mentors. Now, your dean or your professor is not American trained, but he is your attending, he's your professor. So you need to get a letter from him or her. That's a different story. But if you're asking me for the significance, yeah, unfortunately, it will not be held to any high regards because they don't simply know the system, they don't know the person.
Okay. And how can we minimize our cost of total journey?
Yeah, that's an excellent question. So first of all, I think some cities are expensive than the others. So that's one thing you need to see. I remember I was in New York and we were in Apna House, so that helped a lot. But before that, I was in Long Island for an elective. So I was paying $1,100 for a small room in the basement, which is a lot of money. And then I remember I found this place, Alice Manoa. It was a place where blind people live. So I used to take care of blind people at night, and I would go to do my elective in the morning. And what they would do is they would reduce your fare, how much you will be paying for your stay. But it was hectic because I had to take care of them and I had to work and be a student at the same time. So Apna would be a good place to see. Smaller cities is cheaper cost of living. The other way to do it would be go with a friend. Maybe you can share the place with your friend. The other would be to book flights or train. I traveled a lot in train. It was long, but it was cheaper. I remember I took a $1 bus from New York to Rochester. It was $1. I still remember it. There is a $1 bus you can travel. So you will find something. Grocery shopping, there are some farmer markets that can be helpful. But I think the most expenses are actually on the housing. So because the rest, eating, I mean, I was stressed about, I'll eat a piece of bread and I'll be like, wow, oh my God, that's like 100 rupees. And I just went to Pakistan and I found out that 100 rupees is like nothing. But yeah, you would be stressed out that the slice of bread, I would drink Pepsi and I would be like, oh my God, that was just 100 rupees Pepsi, But that's expected. But I think the major comes from your place you stay. I told my parents I would roughly need $1,000 a month. And I think that is just, it can be lower, and it is usually lower, but it should not get more than that because then it becomes very, very challenging. I mean, even $1,000 a month is very challenging in these times. So I understand it's easier for me just to say, hey, I need $1,000 to my parents and they give it to me. But I understand it's great. But I think what you can do is bus travel or train travel, early booking, maybe going with a friend you can share a place with. And then, the hospital cafeteria also gives meal cards for students. So that was my go-to. I remember we were allowed $10 meal at North Shore ILJ, and I would ask them, hey, can I get some extras? So I would, so that would help me a little bit too. But I think the main expenditure was actually on the staying in an apartment. Even small places, they charge you a lot.
Okay. Dr. San, how is OLT going to replace CS? And what are the implications?
That's a good question. It's a work in progress. I'm not 100% sure, but I think it would be not much different from CS exam. Because the physicians that are going to be OET, they're going to be working with ECFMG. So I don't think the quality or may be any different. I would but it's hard for me to think what it will be, but I don't think it's going to be any much different than a CS exam versus the fact that the scenarios may be less and it would be more of an interaction with the physician. On, it would be, I think it would be better because you're talking to a physician rather than someone who's acting to be a patient. So I think overall it would be easier, but I don't think it would be any much different.
Okay. Uh, so a
You
lot of
did,
students want. Okay, you can ask Nahid.
so you just mentioned that you did 2 years of research fellowship after giving your steps and all. So what do you recommend to a person who's having 1 or 2 articles published during the undergrad years, that either research electives, research fellowships are better, or it would be better to do some observerships or externships if they're lucky enough?
Okay. The answer comes down to who is the person who's going to be calling a program director that I think Minahil is a great person and I think you should hire her. Okay. It boils down to that question. Now, if you are with someone for a research elective, that's 1 month experience. Clinical elective, that's 1 month experience. So, clinical elective is better because at least it's something that they need. They want you to have US clinical experience. But if you're someone who's already published 1 or 2, a clinical elective won't help you much. Now, the research fellowship helps not necessarily because you publish a lot, but it's because you go to all these meetings, you meet a lot of big people, you make a lot of connections and bonds, and basically you find someone who's going to make that phone call. I mean, I'm so thankful for my mentor, Dr. Joseph, who helped me during the pathway. I bet it was his phone call who got me the job. In order to have that phone call made, sure, I had to work very hard, but that's the thing. With an elective, you can't make that bond that you for a competitive specialty. But if you already have published 1 or 2 articles, I would strongly suggest that you do a clinical elective, and maybe if you're on time, apply for the match and see how it goes.
Yeah. So you just mentioned that you got 5 or 4 electives after your final year prof. So how did you manage to get those electives? Like you just that one was paid, but the other 3 or 4 were most probably unpaid. So how did you manage to get those electives, sir?
It was all random because I was told by my seniors that you have to email a lot of people, and I did email many programs. I don't even remember. And I was so lucky I got one at North Shore LIJ. It was a general surgery elective. It was perfect because I rotated with the chief residents, the residents, with the program director, with the chair of surgery was there. So that was great. And I did not know how I went to their website, but basically they have a form on their website at that time that you can fill and you can be chosen for electives. So nobody had idea about that program before. So I was lucky in that regard. The second one was at Henry Ford Hospital. That was because, Dr. Gauss Malik is a neurosurgeon from King Edward. So I contacted him, he helped me. So that was that. One was at UC Davis in transplant surgery. I contacted a nephrologist, Dr. Mubashir at Apna, and he's a nephrologist there. So he told me, why don't you contact UC Davis? So I contacted UC Davis and I found that one. And then the other one was in University of Rochester. I was again randomly applying for electives. I didn't even know you have to pay for it. They said, yeah, we will have a vacancy. And then I found out about the pay, which I wanted to go. So that was a thoracic surgery and upper GI surgery. That was also great because I worked with the chair of surgery, the program director there. So majority of my electives were found by trial and error basis that I just kept sending out emails nonstop. And then of course, you can ask around to see if but it's getting harder and harder to get an elective. So the best bet is to just keep emailing people.
Okay, Dr. Singh, can you tell us about the life for female? Because it is very difficult for females to go abroad alone without family and do electives and get a residency there.
I agree. I think the life is very difficult as being alone, women, men, it becomes very hard. I still remember I did not know how to make a cup of tea. I remember waking up at 4 o'clock in the morning, calling my mom, did you make a cup of tea? And being home alone for the first time. I never been without my parents, so it was a shock. So I think what we need to talk about is the fact that the American system really promotes women physicians. It's, you're not allowed to be biased based on your gender, creed, or your religion. So that's that part of the story, that don't be afraid because of your gender you're going to be discriminated, because the system is really trying and to make sure that there are no biases. In terms of the cultural issues, they're definitely there. I think traveling alone is not easy. So that's why I was lucky when I was in UC Davis. I was with a friend, Norman. He was also a student in King Edward. So I think the best would be if female colleagues are traveling together and they are applying together, because I know as a student you may want to have some jealousy that I want to apply there and not tell my friends so I can get the spot. And trust me, if it's your spot, you'll get it. I learned in my career that there were things that were meant to be mine and nobody could take it away from me. So that elective is yours, but try to be collegial with other friends and try to email together in a systematic way that you may be with other friends, because that would solve a lot of problems. And then now with the social media, I think the other thing we can do is, all the program coordinators, you can tell them, hey, I'm a single woman, and these are my cultural, my religious needs, or whatever my needs are. Do you have anybody who can guide me? And you'll be surprised that many other women physicians, there will be Muslim physicians who want to help you. Like when I was in North Shore, LIG, after 2 weeks, I met Dr. Aftab. He was a Cambodian. He was a third-year resident. I never knew about him, never heard about him. But now things are different. You know exactly who's where. So I think trying to get, and don't be shy, tell the programs, these are your needs, and they will try to see how they can help you. And then, we're all here, I understand it can be challenging, but, the goal is not to abandon one another. We are one big family. So whatever the old Cambodians or the people in the community can try to help you, I'm sure they will help you. But I understand it's completely nerve-wracking. It's a very hard experience going alone without your family members. It's definitely hard.
Okay. Naju, do you want to ask something?
Many of the students after their graduation decide to take the steps, and they just have to just let go of their house jobs to take the steps and all to continue the journey. So do you think that is it worth it to just let go of the house job and just do the steps, even if they plan to come back to Pakistan after a while?
That's becoming a very hard topic to answer. If I was me, I would just focus on step exams. But I understand that many students want to do a house job because of the current recommendations from PMDC, and also because of the fact that how hard it is becoming in the US. My only recommendation at that time would be that while you're doing house job, just try to make sure you have at least given step 1 now, because if it's a pass fail, you should be able to pass step 1 during your time. Because in the US, they may not take that much seriously, that you have done a house job. But if you are going to do a house job, I think the best of both worlds would be to get the house job done. But during that time, just make sure you are doing a step 1.
So I just want to ask one question, that looking back to your journey from 2008 to it's now 2021, and do you think that if you go back into the past, and is there anything you want to change or you want to amend that could help you better or somehow?
No, I think everything went smoothly. My debacle with the CS, me wanting to be a surgeon, I think the journey is beautiful. You just have to have a very big heart. I did not understand, things that were very simple for me, like you won't get a job tomorrow. Being a prelim was okay. I really didn't show much emotions, but that was nerve-wracking for my parents that, Hassan, you're going to be jobless tomorrow. So I think I had a one thing I had in my favor was that I was very naive. I did not understand the consequences of my actions, which also helped me make these bold decisions because you don't know what you're doing. So that was very hard for my parents because they knew exactly what I was doing, and it does not. I mean, I'll tell you. I'll be honest with you. I got the step. I got the PGY2 prelim spot when I was at the airport going for Lahore. It was very last minute. The PGY3 spot was also 10 days later because another resident had to go for research. And then for fellowship, also, it's interesting. I could not even make it to my fellowship. Actually, I was late to my fellowship also by 2 months because I would not get the license. And for my job, I was late by 9 months actually. So so it was very stressful for myself. I mean myself too. But now I look back, I am shocked that I did what I did. I was like thinking if I was a normal person, I would not have done any of it. But I don't want to change anything because I tell you, you're gonna change one thing and the other thing is gonna get screwed up. I thought that the experience was very good. It made me a better admirer of what my parents have done for me, a more admire my abilities, faith in myself, and what I wanted to achieve. So overall, I would not change much. But if I were to give you an advice, just try not to screw up your USMLEs. It's just you have so many headaches and then you don't want to have additional headaches.
Yes, sir. And since this step one is pass fail, the CS is excluded. The most that's going to matter are the scores for step 2 CK. So, sir, do you prefer that one should prefer electives during the undergraduate years, or one should start well before preparing for the step 2 CK?
If you're getting a good elective, you should definitely not decline it. That's all I can say. And then the rest you can plan, but if you are getting a good elective, you should not decline it. You should definitely go for it. And then when you're in that elective, you should work hard to make sure you like ace that rotation, because I can tell you, you will be struggling. I was struggling, and the system is very different, but I still remember, I did not know how to talk to people, how to interact. But I clearly remember that one day we were having education rounds and they asked the residents the blood supply of the stomach. And we are from King Edward. We know BD Churasia, we know all the textbooks left and right. So, I knew that I got my hand up and I answered. And that's what it is. Even though we may not know how to interact and we learn, but you have to understand you're very book smart. You have been taught well. So that was my strength too. And that's how they started investing in me. They realized that, he wants to be a surgeon. He's a good person, but he's just not aware of the system. And then they tried to help me. And that's what it will be. You'll see that. And that's all they need to know, is that you really are honest, you are hardworking and dedicated. And then it's up to them to nurture you and nourish you. So if I was getting a good elective offer, I would say definitely go for it and work very hard on it. Try to ace it.
Yes, thank you. So you just mentioned about the interaction stuff. So it may sound a silly question, but I would like to ask that, do you think that we as Kamkolians should start working on our English proficiency, and is that going to matter in the long run? Like, I think it's a spot that we really lag upon.
Minal, the only stupid question is the one that you never asked. So that's the only thing I would say for that part. Regarding in terms of communication, I will be honest. Yes, we do lag behind, and it's something we need to talk to. I'll be honest with you. I have people that have 7, 8 interviews, but when I talk to them, I don't know how to tell them that, you're not going to do well on the interview, because I know what you're trying to say, but you're unfortunately not doing a good job. So, I think that's very important. If you guys, and I can try to help as well, but can chip into at least how to do an interview, because it just you will see that it will help you a lot. Yes, so that's something that you all can come up with a plan on a workshop, that how do you interview, or how do you answer questions, And it's just not like you have to do it on the last day. Actually, last day is the worst day to do it. It has to be while you're in 4th year, 3rd year, 5th year. You talk to your roommates, hey, let's go a scenario, this, or just talk, present a case and see how you do it.
Okay, Dr. Hassan, we have a question from Dr. Shahzeb. How can we take a start in research?
No, Shahzeb is a great mentee of mine, and I think he's doing great. And Usman, you introduced me to him. So how we do it is that, you just email a lot of people. Like, for example, I'll tell you the example of Shahzeb. Shahzeb, he's very dedicated. He's very talented. He doesn't know much of the things that are happening, and that's because he's not exposed. And that's where my job comes in. And that's what it is. You have to find someone who's going to mentor you. They find the talent in you, and then they help you mentor. Now, for the research position, the sooner, the better, because as a med student, if you can publish a case report, maybe, which is very hard. Case reports are the hardest to publish because not many journals would take it. But that gets the ball rolling, and then you can be in contact through Zoom, through online contacts, and just try to write some papers for them, and then you will learn a lot. Even if you don't publish from them, you will learn how things work in the US, and you'll learn from them and take on that. And I did research not because I wanted to be a surgeon necessarily, but also because I wanted to be a scientist. I love exploring new things, and I thought that was a great opportunity. So get involved sooner rather than later. All this, first year, second year, third year, fourth year, these are, I understand the prof and all these are stressful times, but these are just, just relaxation activities. Hey, let's go over communication skills. Let's go over some research projects together. I think the sooner you start, the better, because they would appreciate if you know a little bit more before you start the fellowship.
Okay, Dr. Hassan, we have a question from Dr. Ali. He wants to know what's the score should we target for step 2 CK to be safe side for an immigrant?
Yeah, I think has to be 250 plus, right? These days, the higher you go, the better. So yeah, that has to be, and I don't think that there is anything like a safe score, because everything is so critical. The score is critical. How you present yourself on the interview is critical. Don't underestimate the significance of the interview, and do not underestimate the significance of context either. But yeah, if you're talking about the step 2 CK, I think 250 plus would be a good target to achieve. And some may achieve, some may be 240. So even then, that's a good score to have.
Okay. Now we have a question from Dr. Anam Jafri. She wants to know, how do things look for an older graduate in terms securing a surgical residency?
So they will definitely ask you, why are you an older graduate? What have you been doing with your time? That's very important for them to know. If you were an older graduate because you completed residency in Pakistan, that's a good explanation. But if there are other reasons, then you may have to try to explain your reasoning more. But if it's just as simple as I was in, they want to know what you were doing with your time. So if you were doing research or you were doing clinical stuff, it should be documented.
Okay, I think we're done here. We're done with the question in the chat box.
Okay. Anything else I can answer or help you guys with?
Okay, we have another question from Dr. Anam. Let me, how much does a visa status matter in residency?
It matters a lot. It matters for fellowship. It matters for job. It's a big issue. It's a huge deal. If they had to choose a candidate equally smart as you, not requiring a visa, I think the answer is clear. They're gonna choose that candidate.
Okay, we have another question. For students who came to know about USMLE in mid-3rd year and start preparing for steps from 4th year, of course, 1 year along with the rotation, and 5th year is more about step 2 CK. So what should be our priority after house job, step 1 or step 2?
I would still do step one first, just because you're getting your feet wet, getting into a routine, getting into a rhythm, see how the exam goes, and then learn from those mistakes. My fear is that with step one score not there, you basically don't know how you're going to do in step two CK, because when I had my step one score, I knew how bad I was, and then I need to work harder. Now, unfortunately, the students won't know how good or bad they are because there's no benchmark. So I think it may be better just to give step one sooner.
Okay. We have another question from Dr. Aisha. She wants to know what's the worth of telemedicine electives.
Its worth is higher in fields where patient contact is minimal. For example, if you're going into radiology, it just makes sense. If you're going in some specialties of medicine where they can show, like for example, neurology, and they can show you an exam of the patient is limping, or maybe go over the scan, maybe that's good. But a specialty like surgery, I wonder if it has any significance, because surgery is done in the operating room and it's like a sport. So I don't think in a field like surgery it would be of much significance, but I think in others it may be.
Okay, now we have a question about residency. Should we apply for this year's match if we get ECFMG certified in October or November, or is it too late?
I think if you're otherwise fulfilling all the conditions, I think you should definitely apply and maybe see what the holdup is for the ECFMG certificate. It's a work in progress. I don't know the exact details of what they're doing, but I think they're under also pressure to make sure that you get certified on time to go for the match.
Okay, Dr. San, we have a question from Shazeb. He wants to know what should be final year student be aiming to master during surgery rotation if he wants to be a surgeon in future?
That's an excellent question. So, I've done 5 years of surgical residency. I've done 2 years of fellowship. I've done 2 years of research fellowship. And I just celebrated my 1 month of being an attending surgeon. And I was just told that this is the start of the real fellowship. And then you will become a transplant surgeon in 5 years from now on. So Shazib, it's a marathon, and it's a long way to become that complete surgeon that we all want to be. But if you are, when it comes to being a medical student, I think you have to be hands in the operating room. Cut as much as you can, sew as much as you can, be involved as much as you can. I think the operating part may be in the easier part, decision making, who to operate, who not to operate. Try to build a bond with your attendings and with your senior registrars and whoever is there. Try to ask them, why did you not operate on this patient? Why did you operate on this patient? And when they are operating and they may be looking like, oh my God, they're amazing surgeons. Part of the deal is that they chose the patient that is going to be a good surgical candidate. So don't underestimate the mental thinking process that these surgeons entail in making these decisions. So mastering the rotation is a hard word. It's a very strong word. But if you want to, do well, if that's what you're aiming to, I would try to scrub in as much as I can, and being with the patients and being with the people as much as I can. Books are good to read, but I can tell you, being with people, you can learn so much. There are things that are not told, and for that, you need to interact with surgeons.
So there's another question from Aisha. She's saying that for the students who don't want to take out the route of general surgery and want to opt for plastic surgery or neurosurgery residence, is it even possible to do that, since they are much more harder to get into general surgery than into general surgery?
Sorry, what's the name of the student?
Aisha.
So, Aisha, that's a great question. And again, that's the thing, if you want to be a plastic or a neurosurgeon, then that's the thing that, I was very naive in understanding the risks and benefits. So that's the part of it that is very risky. when it comes to plastic surgery, you have to understand that there is a route that you can be a general surgeon and then do fellowship. A plastic surgery residency is very hard. I know US graduates not matching into general surgery, not matching into plastic surgery. But I do know a couple of IMGs who have matched into plastic surgery actually, and they did a lot of research. I can try to see if I can connect you with them, but definitely doable. Hard, maybe as hard as general surgery. You'll soon realize that they're all equally hard because you have to spend 2 years, 3 years doing research, and you enjoy the ride. It's not that you're going to be doing nothing. So I know it's a stigma that you won't be you won't be doing clinical work, but you'll really enjoy it. Neurosurgery is a different ball game. They have you can't do general surgery and match into neurosurgery. So I think that's the issue with neurosurgery. But the plastics, the easier may be that you go into general surgery and then become a plastic surgery fellow.
Okay, Dr. Hassan, a lot of students want to know the route to obs and gynae residency.
The obstetric gynecology is also a very competitive field in surgery. And unfortunately, I don't know much OBGYNs to help you connect with some, and actually, unfortunately, I have very limited in knowledge, but I can tell you it's a very competitive field. And all the operative fields, they are highly competitive. But again, the route would be, again, talking to and emailing people, trying to find an elective, and trying to do research. I think all these competitive fields, the pathway is the same. Got to do electives, got to know people, got to do research, and just be hopeful that your mentor is someone who's going to help you and support you all the way. I cannot stress for OBGYN, for neurosurgery, for plastic surgery, for general surgery, how important it is to have a good mentor.
Sir, a lot of people want to know that we can apply directly to obs-gynae residency, or do we have to do surgical residency before that?
No, you have dedicated OBGYN residency.
Or it's a separate field altogether?
It's a separate field.
Okay. Sir, a student named Rehan wants to know about the route for interventional radiology.
Oh, excellent question. Interventional radiology is the way to the future. It's the next best thing happening in medicine right now, and they have now dedicated residencies, which are combined residencies for interventional radiology. And again, competitive, and again, the same way to get into them. Research, talking to people, doing a lot of work with them. That's the key to getting into interventional radiology. And the other way would be to getting into radiology residency, and then after that, doing it as a fellowship.
Okay. If anyone wants to ask questions, you can type it right now in the chat box. Okay, I think we're done here. No, the Dr. Anand wants to ask you a question. If we want to come rotate with you, would that be possible?
Adam, I would love to have you. I'll see what I can do. Just shoot me an email. I'll just type it in the and I'll see what I can. I think I just sent it to one student by mistake. Let me send it to everyone so that you have my. Okay, so it has it in the end. I don't know what else is in there, but Anam, that's a good question. I get that email a lot. I'm more than happy to help, but here's the thing. Like I said, remember, it's very important to have a good mentor, and a good mentor. I love to work with medical students, and I would love to work with you all and help you grow, but you can't underestimate the importance of being well known. I'm a 1 month old attending. If you do apply for fellowship and research, you have to go and look at the backgrounds of the people who want to hire you. How well are they published? What's their academic rank? Have they helped someone before matching into surgical residency or any other specialty of their choice? So please consider all of those important, because they are very important decisions to make. Okay, I think we should call it a day.
Yeah,
Yes,
So-
I
sir.
think
We are done. I guess we're done with the questions, right?
Okay, I had a great time, guys. I think thank you so much for having this session. My only advice is to keep your eyes and ears open, keep looking, try to find the field you want to go into, and try to fight for it. And nothing is given. Even the newborn baby tries to get milk from the mother. It's not given that the mother is going to feed the baby. So even a small baby newborn knows that they need to struggle or fight for their rights. So you have to understand that you will have to fight, and it's totally worth the fight. So keep the fight, keep the struggle. It's a beautiful journey. You'll enjoy it. I have so much stories that I can tell you that you would be shocked that I went through all of this, but they are good and funny memories. I forget them because you achieve your goal and you just move on. And my only advice is to work hard, and then don't talk to much people, because you may get distracted in what others are talk to yourself, see what you want. No one can be a substitute of what you're thinking. And then when people are talking to you about you can't match, it's all that they're talking about their own limitations. It's the limitations of their own minds, not your limitations. So don't get upset. And then if people tell you that it's not doable, I don't think you should get upset. I think they're giving you a genuine advice. It's what they think is the right decision for you. But again, it's not that they are not you. So you have to make the decision. But don't get upset if somebody's giving you advice you don't want to hear. But that's part of being open, right? You do want an advice that may not be what you're thinking of, but it is a real advice. And then, just to make sure you do well on step 1, step 2, do electives as you can, build contacts, try to follow people who are smart and well known, and do research if you can. And I assure you that the success would be in your feet.
Thank you so much, sir. Thank you so much for taking out time from your busy schedule to guide the junior Camcolians that aim their post-graduation in the US. And you have made extraordinary achievements, and we as Camcolians are completely in awe of your perseverance and resilience. So thank you so much, sir. And we really look forward and look up to you as the one we're going to follow the footsteps. And
I treat the students as if they're going to be my colleagues. I don't treat them as their students. You are going to be my colleague tomorrow, and it's just an honor to be with all of you today. And I'm very busy, but I'm never busy for the students. So I make sure I have time for them. So all in all, thank you so much, and we'll keep in touch.
Yes, sir, inshallah.
Okay, take care.
Sure.